Sir, we are on live and we are starting the session, sir.
Okay, can start.
So, very good afternoon, doctors. I'm Dr. Salil on behalf of Shield Healthcare, welcoming you all for today's webinar. The topic for today's webinar is the role of probiotics in IBS. So, I welcome all the participants. I request them to post their queries, if any, in the chat box so that we can have a short QA session at the end of this presentation. Now it's time to introduce our invited speaker for the day, Dr. Asadullah A. Karigar, sir. Sir has done his MBBS FICC and sir is currently the practicing physician at Karigar's Cardio Diabetes Clinic, Hubli. So with this short introduction, I welcome you, sir. Handing over your session to you for your presentation, sir. Welcome, sir.
Good noon to all. Can we start the session?
Yes, sir. Yes, please.
Good noon to all, and thank you for giving me an opportunity to talk on this IBS and the importance of probiotics in IBS. So we'll start from what is this IBS? In just short, we can see this. What is IBS? Farooq? Is it visible, audible?
Yes, sir. Yes, sir.
Yes, sir.
What is IBS? IBS is a syndrome, group of symptoms. नहीं वो वीडियो नहीं दिख रहा था मेरे को हटा दिया उसको ठीक है A syndrome group of symptoms which consistently occur together or a condition characterized by a set of associated symptoms. One man's constipation is other man's diarrhea. And the exact causes are unknown. So in 2006, the Rome criteria was revised. Later we can see that 20% seem to start after an episode of gastroenteritis, gut infection, toxic bad microbes, or post-infections. In short, we can see this colon structure and function, which is large intestine. We have ascending colon, transverse colon, descending colon, and sigmoid colon. Then functions of colon is elimination of waste materials from stool produced by the body, reabsorption of water in the waste, reabsorption of electrolytes for maintaining the water balance in the body, site for growth of beneficial bacteria and other microorganisms, and maintaining flora of the gut. Coming to irritable bowel syndrome. Irritable bowel syndrome is not a disease but a functional disorder, which means the intestine does not work as it should. IBS is a common disorder that affects the large intestine. IBS common causes it is not exactly like mentioned here. We have some criteria for that called as Rome criteria, and it's present in the slide. We can see those. Exactly, the causes are there are so many of causes, but the symptoms which we can see here is cramping, mainly the abdominal pain, bloating, gas, diarrhea, and constipation, or mixed. Irritable bowel syndrome. It causes negative impact on quality of life, decreased productivity, adds anxiety, stress. Diagnosis and treatment may get delayed because so many of differential diagnoses which collapse the symptoms of this IBS. History of this: first, it was described in 1771. 50% of the patients are less than 35 years old, and 70% of sufferers are symptom-free after 5 years. In first phase of this type of medical, GPs encounter one new case per week, and GPs see total 4 to 5 patients a week with IBS. Prevalence of 50 to 40 patients per 2,000. Epidemiology, we can say that is chronic relapsing and often lifelong disorder. Because the diagnosis is late and we can't exactly diagnose it so early. And prevalence is 3 to 22% worldwide. Majorly it is seen in big cities. One of the things of this IBS onset before age 35 to 40, and females and male. Females are more prone to this for IBS, and the rates of estrogen and not only these two hormones, but so many hormonal disturbances in females, characterized by the presence of abdominal pain or discomfort. This is the main symptom of this IBS. IBS diagnosis should be considered when a person presents with unexplained abdominal symptoms or whenever the symptoms does not collapse and when we rule out everything and we can confirm with IBS. As I said, we can see here the given map. IBS is more, more seen in big cities. Causes of this IBS. IBS is a multifactorial disorder. The symptoms are due to gastrointestinal dysmotility, inflammation, visceral hypersensitivity. This is the pathophysiology of IBS. Altered intestinal microbiota, diet and stress exposure, infectious GIT, post-infectious GIT, and post-traumatic stress disorder, people with anxiety and depression. These are some of the causes. Crosstalk between the brain and gut axis. We have one brain-gut axis, which includes CNS system, and the disturbances in the central nervous system and the ENS causes the disturbances in the gut and the brain axis, which might be endocrine as well as exocrine. We have more BJ pathways like the GI system, including central nervous system, endocrine, neural, or immunal pathways. Mainly, this brain and gut axis serve the immune pathways where hormonal disturbances are seen and one of the cause of IBS. Stress-related alternate. These are picturized the causes of IBS: altered gastrointestinal microbiome, infections, neuronal plasticity, bile acid malabsorption, increased mucosal permeability, genetic morphisms, and brain gut dysregulation, altered motility of intestine, maybe due to food also. That gastrointestinal dysmotility, it may be due to two conditions where IB, irritable bowel syndrome is, whereas in one constipation is predominant and in the other one, which is IBSD, is the diarrhea predominant. Symptoms of IBS, as we have seen before also, abdominal pain as well as discomfort is the main symptom of IBS, cramping, bloating, flatulence, nausea, irregular bowel movements. It might be constipation, diarrhea, or a mixed form of this one. Variation in stool formation, feeling of incomplete defecation, mucus in the stool, several bowel movements per day, and suddenly feeling after having a bit food, we can feel the fullness of stomach. Even that is a symptom which is not mentioned over here. Common symptoms, we can see constipation, diarrhea, mixed bowel habits, as mucus in the bowel movements, feeling of incomplete bowel movements, looser and more frequent stools, abdominal pain and bloating. And IBS subtests are based on the predominant stool and pattern of the stool. Before this, we can the classification and diagnosis, exact diagnosis, I think it is mentioned here or no, but Rome criteria where we consider to confirm the diagnosis of irritable bowel syndrome, where Rome criteria says it should be three times a week in a month for more than 6 months. Here, Bristol stool chart is given where the stool patterns, with the stool patterns like severe constipation, we can see mild constipation and normal as a sausage shape and smooth or snake shape, lacking fiber, and mild diarrhea and severe diarrhea. Type 7s are given here. Stool type and frequency, which is this one in IBS, we can see more than 25% hard or lumpy constipation, diarrhea more loose or watery, and mixed pattern, we can see more than 25% hard or lumpy or loose watery, and specified is hard or lumpy or complete watery stool. IBS can be subdivided into constipation predominant and diarrhea predominant and alternating constipation and diarrhea that is mixed. Diagnostic criteria, as I was telling, like for Rome diagnostic criteria 1, 2, 3, and 4. In practice, we got in studies so the Rome criteria 4 diagnostic criteria showed more this one. Rome 4 defined irritable bowel syndrome as a function bowel disorder which abdominal pain is associated with defecation or a change in bowel habits. Disordered bowel habits are typically constipation, diarrhea, or a mix of constipation and diarrhea. Symptoms abdominal. Symptom onset should be occur at least 6 months prior to the diagnosis, and symptoms should be present during the last 3 months. Like frequent, in short saying, we can say frequent abdominal discomfort is the main thing we can see. Patients meet Rome criteria for IBS when recurrent abdominal pain more than 1 day per week on average in previous 3 months, associated with at least 2 of the following: pain related to defecation, change in frequency of the stool, change in the form of appearance of the stool, and mainly abdominal discomfort. We can't take care of abdominal pain, but abdominal discomfort is the main symptom we can go out. Rome's diagnostic criteria supports symptoms: constipation predominant, abnormal pain less than 3 times a week, hard or lumpy stools, straining due to bowel movements. Diarrhea predominant is more than 3 bowel movements per day, nausea, watery stools, and urgency. General feeling of incomplete evacuation, passing mucus per rectum, abdominal fullness, bloating and swelling, and sudden fullness of stomach before eating, which is not mentioned here. And the diagnosis here, algorithm of this IBS diagnosis, as I told, Rome 4 criteria meets and evaluation and rule outing other diseases, and well as diagnosis, like when the patient is predominant with constipation mixed or is having diarrhea with complaints associated physiological impact. In people with IBS, in 25% have depression, 5% have anxiety. In one study, 75% of women have dyspareunia. Stressful life events are associated compared with control. People with IBS are less well educated and more for general health. And as we saw before, also women are more prone to this for IBS as they have more hormonal changes. Management is like lifestyle. Before this, when a patient comes to us, we should consult the patient before starting the management. Lifestyle or diet modifications. A diet low in fermentable is FODMAPs, fermentable oligosaccharides, disaccharides, and monosaccharides. These are short in carbohydrates and sugar alcohols that are poorly absorbed by the body. Wheat dairy, and it includes also apple. Avoid tea, coffee, alcohol, and avoid gluten. That's what I wanted to say here in the management. When the patient comes, suddenly we can't diagnose this. Ruling out other so many things like gluten is there, like tropic sprue. Everything should be ruled out, and the management should be started. Lifestyle modifications like low accident medication, over-the-counter agents, fiber, and laxatives depends on the predominancy of the IBS. Diagnosis step, counseling, we're reassuring the patient, as I said before, lifestyle modifications like increase soluble fiber and decrease the FODMAPs. Physical activity, avoid stress and sleep deprivation. In constipation, treatment plan for this IBA, this one. In constipation predominant, we can give the osmotic laxatives, antispasmodics, and mixed we can give antispasmodics for this abdominal discomfort, and diarrhea we can give antispasmodics and loperamide, where you can see. And the important drug for treatment we take is here is rifaximin, because so many studies give maximum of support that rifaximin helps, and it is the best drug for treating IBS. And other tricyclic acid antidepressants can be used for depression, and linaclonate, new drug, and lubiprostone also can be used. And SSRI psychotherapy also can be used. Therapeutic approach: establishment an empathetic physician-patient relationship, which involves counseling of the patient. Therapeutic approach: dietary recommendations. No specific advice has been shown to efficacy in trials. Expert opinion in limiting alcohol, caffeine, fat, and gas producing food, like FODMAP, which includes FODMAPs only, like fermented oligosaccharide, disaccharide, and monosaccharide, and polyols. Therapeutic approach: diarrhea predominant. Where diarrhea is predominant, we are going with the low pyramid 2 to 4 mg, QID, and cholesterol, aldosterone. Constipation predominant, we are giving fiber supplements, osmotic laxatives, lactulose, magnesium citrate. Triglyceride, which is not so. Pain predominant, dicyclamine, and normal antispasmodic also can be given. Amitriptyline, paramine also can be used, which I use. Antibiotics, there are growing body of evidence supporting the role of antibiotics. Rifaximin, ciprofloxacin, metronidazole, and we usually prefer rifaximin when the patient is diagnosed with IBS, which have strong studies for supporting IBS. And mainly the topic given the second topic is the role of probiotics. Mainly in this IBS, due to so many causes and other things, the normal microbiota of the large intestine or the small gut or this large gut, the normal microbiota is disturbed, where bad and good microbacteria are in balance. When this balance is disturbed due to any of the causes which we have seen in the before slides, causes the symptoms. Intestinal microbiota. The intestinal microbiota is more important for maintenance of the host health, providing energy, nutrients, and protection against invading organisms. Colonic microbiota is relatively stable throughout adult life, regulated changes in gastrointestinal as well as changes in diet, and the host immune system reactivity, inability affect population composition. Now, for maintenance of this, balancing the intestinal microbiota, this pre-probiotics and prebiotics both help. We have some studies where these probiotics help and prebiotics help in the maintaining the microbiota. Both prebiotics and probiotics are important for human health. However, they have different roles. Probiotics, they are live bacteria found in certain foods or supplements. They can provide numerous health benefits. Prebiotics, these substances come from types of carbs, mostly fiber, that humans can't digest. The benefits bacteria. Yogurt eat this fiber. The gut bacteria, collectively referred to as the gut flora or gut microbiota, perform many important functions in the body. Eating balanced amounts of both probiotics and food can help ensure that you have right balance to this bacteria, keep the gut microbiota healthy. That's what, as I said in short, like the intestinal microbiota has both good and bad bacteria. The imbalance between this can cause the symptoms of IBS. How can probiotics help in IBS? Probiotics are dietary supplements which contain live bacteria that are known to be beneficial to the digestive system because of its ability to balance intestinal flora. Probiotics are in the form of capsule or pills. Several studies have proven that health benefits of probiotics strengthen the immune system and promote better digestive processes. Not all strains of bacteria in probiotics can be beneficial to IBS patients. Some studies show that some strains which are very important to maintain the gut flora, which we use in the present drugs. We can see later which are those. And increased number of faculty to anaerobes in conjunction with decrease in beneficial organs such as aerobic lactobacilli and bifidobacteria amongst other aerobes have been reported. These changes, along with the general reduction in species diversity, is the most important bacterial groups and which diet and digestive such as intestinal transportile, may result in increased putrefaction of colon with subsequent disease. Resident bacteria within the human gut are considered to represent the crucial line of defense against colonization of potential pathogenic microorganisms. Dietary supplements containing prebiotics, combination of both these symbiotics. Microbiota combination of beneficial good and disease producing bad microorganisms, good and bad bacteria. The beneficial microorganisms keeps pathogenic organism under control, and as I said, the good and bad should be balanced. Gut tuberculosis, harmful bacteria and good bacteria helps in normal function of intestine. These viruses have led to the imbalance in the gut. Gut tuberculosis is a normal function of the intestine. Because you can see here in the colonoscope, the healthy and inflamed gut displays immune reaction. Gut has a mucus jelly full of good bacteria. Tight junction permeability permits the grant only of good substances. Entry of bad substance triggers immune reaction. This immune reaction disturbs all the pathophysiology of the gut, where IBS the usual starts, and the IBS is started. Healthy gut versus leaky gut. We can see this intestinal content, mucus layer, and epithelial cells. The wall of the normal this one and leaky gut of IBS. We can see what happens in IBS leads to damage of intestine. This results to the imbalance in the intestinal flora of bacteria. And the bad bacteria win over the good bacteria. The symptoms of IBS occurs. Imbalance in the intestinal flora and lead to change in the optimal pH. It also BG axis. It also disturbs the BG axis, brain and gut axis. And research and evidence for probiotics in IBS, which they can help. In a study published in the Journal of Gastrointestinal Hepatology, it has been proved that multi-strain and multi-species of probiotics are beneficial to IBS patients. Multi-strain probiotics have been found to provide general relief of IBS symptoms such as abdominal pain, discomfort, and bloating. Additionally, multi-strain probiotics can have a significant effect in altering the intestinal environment. Why need it in IBS? Why this good bacteria we need in IBS? As some studies have proved that some strains of good bacteria which helps in IBS for maintaining the gut flora. We can see IBS symptoms have been linked to changes in the gut flora, and people with IBS have lower lactobacillus and bifidobacterium in their guts. And some strains which are mainly studied for this bifidobacterium is longus and brevum, and in the guts, and higher levels of harmful streptococcus, E. coli, and clostridium. Even Shigella also can be mentioned here because it also causes disturbance in the microbiota of the gut. Changes in the gut flora may increase inflammation, increasing sensitivity to gas and intestine, reducing immune function, and changing digestive motility. IBS symptoms occurring most post infection or after antibiotic use. Good lactobacillus due to antibiotics. Role of probiotics in IBS. Probiotics have been proposed to improve symptoms by inhibiting the growth of disease-causing bacteria, enhancing the immune system barrier functions, helping fight inflammation, slowing down bowel movements, reducing gas production by balancing the gut flora, reducing the gut sensitivity to gas buildup. Overall IBS symptoms improvement. Probiotics help, as everything is mentioned here, for the betterment of the gut. And probiotics, which mainly were helpful for IBS. You can see probiotics in upload system reviews and probiotic therapy for irritable syndrome. These are some studies where some strains which were studied, and we can justify where some probiotics and prebiotics are helpful for maintaining the gut of the microbiota. Best probiotic for IBS: Lactobacillus plantarum. It relieves bloating and abdominal pain. Lactobacillus rhamnosus decreases the intestinal frequency of abdominal pain in IBS. Lactobacillus casei decreases subtle pain in IBS. Lactobacillus acidophilus relieves bloating, abdominal pain, and motility. Even Lactobacillus longus also helps in relieving the pain abdomen here. And probiotic is bifidobacterium. Other substrains are also there. This has been found to have the most promising results in the treatment of IBS. And bifidobacterium bifidum is a clinical trial done on the strain. 47% of the people with IBS had reported improved symptoms of IBS with this strain, bifidobacterium. And Lactobacillus acidophilus and Lactobacillus rhamnosus. Other strains of this Lactobacillus and bifidobacterium help mainly, which are have studies for supporting IBS. Power of 7 specific strains we can see here. Lactobacillus acidophilus, rhamnosus, Rotary plantarum casei, Paternum, bifidobacterium bifidum, fructooligosaccharides, 100 mg. In the billions, total count will be 10 billion, which colony forming unit completing all these strains, we can totally get of over 10 billion colony forming units of good bacteria. Coming to the summary, IBS is a gastrointestinal disorder characterized by chronic abdominal pain and altered bowel habits in the absence of an identified cause. The causes and pathophysiology of IBS are multifactorial. Probiotics have significant role in IBS. And even some points I have to add on this summary, which are not being given here, mentioned. Before diagnosing this IBS, we should first rule out the other conditions which mimic the symptoms, like hormonal disturbances, celiac flu, gluten. We can give gluten-free diet to the patient and see other inflammatory diseases like Crohn's disease and other inflammatory bowel disease. After rule outing everything in which mimic the symptoms of this IBS, then after going for some of the diagnostic tools, we can come and diagnose it as IBS. Okay, thank you.
Thank you, sir. Thank you very much for that wonderful and detailed presentation, sir. Yes, sir. Nowadays, IBS has become one of the most common problem in most of the Indian population, sir. Sir, I have a few questions like what will be the prevalence of this IBS, sir? How many patients do you treat in regarding this IBS, sir?
Almost around 20% of people, we can say, we can easily, after concluding all and ruling out other diseases, we can say IBS is a global syndrome for us.
And sir, when we come to this diagnosis, you said that we have to rule out the other problems. So whether we are misdiagnosing this IBS, sir, most of the cases they are thinking like it has a common constipation, common diarrhea. So whether it is ignored, what's your opinion, sir?
Yeah, I think IBS can't suddenly be diagnosed, and we can't label at least 3 to 4 attempts patient visits. Then we can easily rule out and come to this, because so many drugs also causes the same symptoms. So many drugs causes constipation, and so many drugs causes diarrhea and altered habits of the personal habits of the patient, which complete history we can't take, or the complete history is not given by the patient sometimes. we can't directly come to an end that is IBS.
Okay, sir. Sir, what about the diagnosis, sir? What will be any evaluation parameters whether this patient is having this IBS problem apart from this stool analysis, everything, sir? So, whether any other tests available?
Yeah, colonoscopy is there, and we can for gastroesophageal colonoscopy also. We can examine the small gut also, and we can see the extent of the intestinal wall when we are coming to real diagnosis. And enema radiographs also are there. Barium enema where it is given, and the gut is watched in the radiographs.
Yes, sir. Sir, what will be the duration of this probiotics, sir? So, how long they have to take these probiotics to recover from this IBS, sir?
Exactly, the time duration is still not known, but when IBS is there, we try to stop all the control the patient's diet, and we continuously, at least for 6 months, we usually see the patient to take this one by controlling the diet.
Okay, sir. So, let me wait for 1 or 2 minutes for the participants to post their queries, sir. If there is any queries from the participants, then I will read out for you, sir.
Okay.
Yes. Thank you, sir. It was another one important topic which we have in the present conditions, sir, in the current situations where the food habits have been changed, the work which their occupation has been changed, and the diet which they are taking also has been changed, and most of these reasons ultimately end up in this IBS, sir. So, and it
One more
is, yes, sir.
point I want to add over here.
Yes, sir.
One more big like cause I can say for this IBS is like bad usage of this antibiotics. Some due to some suddenly we self take some antibiotics, which is very bad for the flora. I just give a message that until and unless the doctor prescribes some antibiotics, there is no need to take of any antibiotics by self.
Yes. So, participants, if there is no queries, then we can end the webinar for today. Any questions?
Okay, there
Yes,
no
sir.
question.
So there is no questions in the chat box, sir. So if there is any questions, then we will be sending you the mail, sir, or through WhatsApp.
No,
You can just address all those queries.
we'll end it. We'll end it.
Yes, sir. Thank you, sir. Thank you very much for being with us and for sharing the wonderful topic on IBS, probiotics, and IBS, sir. Thank you, sir. Thank you very much, sir. And we are looking for many more interesting webinars with you, sir. Thank you,
Thank
sir.
you
Thank
for
you.
I thank Connect Shield and our representatives who gave me an opportunity to for represent Kulkarni ji, Farooq ji, for giving an opportunity to talk with you. Thank you.
It's always a pleasure, sir. Welcome, sir.